if you have 50, 100, 2 or 300 patients that have prepaid you for all this money. So let's say you have, $100,000 of money that has been prepaid. And let's say this would be virtually impossible. All these patients want their money back, and you've spent the money already. So now, how are you going to pay all these patients back?
Welcome, Genesis Nation. If you have not met this gentleman, I don't know if you've been in the profession, in the chiropractic profession. So I'm going to be patting you on the back a lot, Doc. So Dr. Marty Kotlar with Decoding. I've been involved with you even probably 10, 15, 20 years ago. But Dr. Kotlar has a really unique perspective on what he does. If you guys don't know, he's certified professional coder, also with the American Academy of Professional Coders. The most unique part about Dr. Kotlar, can I call you Marty? Is that okay? Or you
Sure.
like that?
All right.
Cool. He's a cool guy. Awesome. Very easy to talk to. And you also practice for 16 years. So it's not like most of the coders and people we talk to, they just know things by the number and by the paper. But talking to you, you have a real life experience, dare I say wisdom, about practicing and how codes are relevant to that. So you've been teaching coding and compliance and everything to keep us out of orange jumpsuits. So thank you for that. Now, I'll do a quick overview that Genesis and Target Coding are now offering credentialing services. So Genesis basically offers credentialing services powered by Target Coding. We're going to talk about that in more detail. But what we wanted to really go over today are the top 3 mistakes that chiropractors make when it comes to billing and coding and compliance. So I'm going to let you take over from here, my friend.
Yes, well, to begin with, thank you for inviting me to do this. I want to thank everyone over at Genesis for inviting me to do these introductions. So yeah, I'm a chiropractor. As you said, I practiced for 16 years, and I'm also a certified professional compliance officer, certified billing and coding specialist. So, I consider myself kind of unique because, as you mentioned, most doctors are not certified coders.
Nope.
Most certified coders are not doctors. So that's why, I try and combine both specialties to make sure doctors are doing things compliantly. They're following the laws and rules, and, they're getting reimbursed, what they deserve. And, some people call me the insurance guy. I don't consider myself the insurance guy. If you want to put a label on me, I consider myself the compliance guy. Compliance as it relates to coding, compliance, cash practices. I would say about 20% of the doctors we work with are cash practices. So compliance as it relates to billing, coding, Medicare, HIPAA, making sure you're following all the laws and rules. So yeah, and other than that, I've written many training manuals on chiropractic billing and coding. I write articles to major magazines and publications. Chiropractors have coming across their desk, like Chiroeconomics and Dynamic Chiropractic and the American Chiropractor. I also speak at a lot of state association conventions. So yeah, I've been around a while, have quite a bit of experience. My team and we work with thousands of doctors and their staff members. So you had asked me to put together some of the 3 most common mistakes. So I have some notes here. I took some
Good.
notes.
Awesome. Well, before you jump into that, I just wanted to focus on one quick item because, we offer Genesis, has an element or like a vertical that we use for cash practices. And a lot of times cash practices feel like they're outside the world of compliance. But the more I dive into the business of chiropractic and multidisciplinary, even if it's cash, when we talk about the 3 mistakes, I know we're going to break it into cash practices, PI practices, and major medical, including Medicare under there. So that's just more out for our Genesis cash clients. I want to make sure that we're all within compliance as we are licensed practitioners. So go back to those notes. Sorry.
Yeah, so I decided to break it down into the top three mistakes for insurance, for PI, and cash.
Yeah.
So break it down. So I'm going to start with insurance.
Okay.
One of the biggest mistakes, or one of the things that is very important, is to track every payment that comes into the practice, because here's what we hear at our help desk. We're in network, the patient's copay says $40, but we submit the claim and it says the patient's copay is $20, and we're out of network and we accept assignment. When we call to verify coverage, they said it's covered. We submitted the claim and now they're saying it's not covered. So all of these things can cause a lot of confusion at the
Yeah.
front desk.
Yeah.
So I think one of the most important things to do for insurance practices is to track every single payment that comes in and put it into something called, we have something called an insurance tracking spreadsheet. So you know exactly what will pay. So here comes Mrs. Smith. She works for AT&T. You happen to be in network with this plan. So you know that this plan has a $40 copay. So now every time one of these patients comes in, you should ask for $40. Now, if the claim doesn't get processed properly, that's another item, a subcategory of this, which is staff members get a little confused when they submit a claim and it comes back with zero payment.
Yeah.
So it's another thing we hear. Dr. Kotlar, or they call Brandy and or Natasha at our help desk. We submitted a claim for $1,000 and we got zero. What happened? Well, the first thing is, did the claim get processed properly? Meaning, let's say this patient had a $1,000 deductible. So you submit the claim for $1,000, it goes towards the deductible, payment is zero. Did the claim get processed properly? The answer is yes. So the patient owes the $1,000, versus we bill $1,000 and it comes back denied, missing modifier, bundled service, missing NPI number. Oh, so then the claim didn't get processed properly and you have an opportunity to resubmit it. Or does it say this is not covered in the plan, or a duplicate service? So that's one of the things that, when it comes to insurance practices, tracking and making sure you're getting paid for every service that you provide.
And I would say every penny, every penny.
Yes.
I'm gonna do a shameless Genesis plug here, because we are on Nation, and our provider claims workbench can track to the penny with all those things, looking at modifiers and the validations we made. But this is not about us. This is about you, target coding. So
So another one of the things we recommend to prevent problems is every man, woman, and child that comes into the practice, put them into a category. So we've narrowed it down to 8 categories: cash patients, in network, out of network, Medicare, that's the first 4, PI work comp, DMPO, which is discount medical plan organizations like ChiroHealth USA, health savings accounts, and direct primary care, which is available only in 25 states. So if an office has this down to a science, where every single patient that comes in, they know to put into one of these 8 categories, it makes life a lot easier. So tracking was the first thing when it comes to insurance. The next thing when it comes to insurance is timed codes, time-based codes. Insurance companies make a big deal about this if they are looking to evaluate your notes. Like some offices, they have to submit their notes with personal injury claims and workers' comp claims. You have to submit your notes, or if there's a request for records. So there seems to be some confusion out there, even though, this has been going on for many years when it comes to unit billing. So the first thing that the providers should be aware of, there are certain codes that are not time-based, like 97012. That's mechanical traction.
Not time-based.
It's not time-based. However, from a compliance standpoint, the doctor should put down traction was applied to the cervical region for 10 minutes. So at a minimum, put down, the location and the amount of minutes, but it's not a time code. You could do unattended electrical stim, which is 97014. Some health plans like United Healthcare don't accept 97014. You have to use G0283. Another thing that staff members should be aware of these little things, because that's another thing. Every couple of months, we'll get a staff member saying, we got denied for electrical stim. I guess United Healthcare doesn't pay for your electrical stim anymore. And we evaluate the situation, and they pay for electrical stim. You just have to use the G0283 code.
Right.
So that's not a time code. You could put the stem pads on a patient and you could walk out of the room. You could leave the patient in the room for 10 minutes, 20 minutes, 30 minutes. You could even come back into the room, take the stem pads off the lower back, put it on the neck for another 10 or 15 minutes. All of that, one unit, because it's not a time code.
Mm.
Now, when it comes to timed codes, like therapeutic exercises 97110, according to not me and not to Genesis, according to
The rule. Yeah,
Medicare
yeah.
and all the insurance companies, State Farm, Geico, Allstate, they want one unit to be at least 8 minutes, all the way up to 22. So there's a range, 8 to 22, with 15 being right in the middle. So 15 is the average, but if a doctor wants to do ultrasound, oh, that's a modality, that's a timed code where you have to stay with the patient. Ultrasound, therapeutic ultrasound, not diagnostic. So if you spend 8 minutes doing that, sure, you could bill code 97035. If you spend 8 minutes doing 97110, that's, up to 22. It could be as little as 8, all the way up to 22 for one unit.
Okay.
So in order to build 2 units, you got to get to that 23rd minute. So 23 to 37 is 2 units. This is the tricky part. Insurance companies use something called total time. So if a provider does, let's say, 23 minutes of 97110, that's therapeutic exercises, and stops treating the patient at that point, can you bill 2 units? Yes, you did it for 23 minutes. But the provider says, I'm going to do another 23 minutes of, let's say, ultrasound or 97140 manual therapy for another 23 minutes. Many offices, well, some offices will say, oh, could bill another 2 units because I did another 23 minutes. Wait a second, time out. 23 plus 23 is 46 minutes. 46 minutes is only 3 units. So that's where it gets a little confusing. The next part that gets confusing is in the notes. Some providers, they will put therapeutic exercises performed to the lower back for 1 unit. That's not going to work with an insurance company. Others I see, neuromuscular re-education provided to the lumbar region for 8 to 15 minutes. Wait, 8 to 15 minutes? Why are you putting a range? Just put in, was it 8 minutes, 9 minutes, 10 minutes?
Exactly.
So put in the amount, the exact amount. Now, I've had some providers say, well, how do I know how many minutes? You mean if it's 12, I should put in 12? How do I know it's not 13? Well, you better know, because if the insurance company asks you, Dr. Kotlar, I see you put in the notes, therapeutic exercises was performed for 10 minutes. I have a silly question, Dr. Kotlar. How do you know it was 10 minutes? Better have a good answer. Like, yeah, I wear a watch, or I have a clock. In every room, I have a clock, or I have a neck timer.
Yeah,
I have a timer. Versus, oh, I don't know. I think it was about 10 minutes. So
this emoji is not a good answer for when the insurance company comes knocking, right?
Yeah. So time codes is one, and
time codes. Yep.
Yeah, and number 3 that I put in for regular insurance is not maximizing reimbursement. Oftentimes, doctors will say, Marty, I seeing about the same amount of patients as I was seeing last year, but I'm making less money this year. What's going on? And typically, doctors are missing out on a few things. So here's a few pearls. I hope whoever's listening to this writes this down. The first one, 97535. That's activities of daily living. Now, forget about it. I guess we're in the insurance category, but this is something I did even on my cash patients, which was if a patient says, Dr. Kotlar, I have a child, a 6-month-old child, and when I go to lift that child off the floor, that's when I feel back pain. So I'll tell this patient, okay, I'm going to spend about 10 minutes showing you how to bend and lift items off the floor. You have problems raking leaves, shoveling snow, getting in and out of the car. Uh, you sit at a computer and you tell me after 5 minutes you start to get neck strain. So let me spend time showing you how to sit at a computer, how to do elbow exercises, how to do neck exercises. And that's a code that often gets missed, or a service that gets missed. Another one is extremity adjusting.
Yeah.
Many of my clients, they go into the room, they know that this patient has a 3-region adjustment, cervical, thoracic, lumbar. You walk into the room and Mr. Williams goes, "Hey, Dr. Kotler, just want to let you know, I was playing pickleball yesterday and my shoulder hurts." And a lot of chiros will go, "Let me check that shoulder. All right, let me adjust it." And they won't even write down that they did it. They won't bill for it. So there's 2 strikes. Everything you do must be written down, even if you
Yeah.
don't charge for it,
Yeah.
So those things often get overlooked. That's something that is reimbursable. Also, re-exams, oftentimes, like this patient, "Doc, I was
Yeah.
playing, I went down to tie my shoes this morning and my back hurts more." That's an indication to do a re-exam, and doctors are missing out on re-exams, especially since the new guidelines changed in 2021. The documentation guidelines for exams and re-exams changed, so it's much easier to get paid. It was based on an initiative that the federal government put out. Probably it was pre-COVID, maybe 2018, 2019. The initiative was called Patients Over Paperwork. So when I saw that, I'm like, "Ooh, what is that?" It was specifically to reduce administrative burden placed on doctors and staff and allow doctors to get paid for every minute they're with the patient.
That's great.
So yeah, so you walk into the room, some patients will say, "I've had this." You walk into the room, "Dr. Kotler, oh, I forgot to tell you, look at all these MRIs. I forgot I have MRIs from the orthopedist that I used to see a few months ago. And here's some x-rays from the physical therapist that I was seeing 2 months ago. Here are the records." So now if you look at those records,
You can bill for it.
you could bill for it every minute
Yeah.
you are with the patient. So re-exams get overlooked, the ADLs, and yeah, those extremity adjustments. So those are some of the key things for regular insurance.
Those are definite pearls of wisdom. And because this is as a practicing chiropractor, these are things I didn't want to pay attention to, yet I had to pay attention to because I wanted to run a successful business and again avoid the legal ramifications. So what's different about from a cash and PI perspective?
Okay, so let me take a look. What do I have on my notes for PI? Let's do PI next, and
Okay.
we'll do cash last.
Okay, got it.
So PI. Okay, so for PI, one of the most important things is if you want to get on the good side of the attorneys, so they'll send you more new patients, your SOAP notes are very important. So if an attorney, a patient, your notes get subpoenaed, you want to have good quality SOAP notes. Now, there's something in personal injury called loss of enjoyment of life and duties under duress. So this is where patients will come in and they'll say, "Ever since the car accident, Dr. Kotler, I don't sleep through the night anymore. I usually sleep no problem. Now every hour I'm tossing and turning." Or, "Dr. Kotler, I'm a student, and ever since the car accident, I have trouble concentrating. I feel fogged in the head. Dr. Kotler, ever since the automobile accident, I have seizures. I've never had seizures." And all these things could occur, blurred vision, slurred speech, traumatic brain injury. So if this is causing the patient, normally I bowl. I'm in a bowling league every week, Dr. Kotler, because I have dizziness since the car accident. That is preventing me from bowling. So these are known as duties under duress, loss of enjoyment of life.
Great.
Very important in PI to focus on those things. Why? One of the reasons why, as chiropractors, we don't treat fractures. We're not allowed to treat fractures. So, as chiropractors, we treat soft tissue, basically soft tissue injuries. So, the defense attorneys that work for Allstate, Geico, State Farm, they'll call what we treat MIST, MIST, minor injuries to soft tissue. Like, how bad could it be? We're looking at photos of the car. There's no damage to the car. You
Right.
don't have any fractures,
They don't
Mrs.
know
Jones.
they don't really get the biomechanics and the physics of those
Right.
traumas. Yeah.
The car doesn't, you were in a little minor fender bender. There was no damage to the car, no fractures, no broken bones. So why do you need all this care? Why is this well, this patient can't go to work. This patient can't do their, vacuum, mow the lawn, do the laundry, take care of, so that's first with PI. Let's see, what else did I have for PI? Oh, so some chiropractors, when it comes to PI, they'll do things on PI patients that they don't do on their regular patients. So, like every PI patient gets an NCV, gets a TENS machine, gets a back brace. Careful with that, just because insurance pays for those things. Now there are times where it is indicated. Just get used to those versus, oh, this is a PI patient. I'm going to prescribe this patient a back brace. So State Farm, Geico, Allstate, they'll look at those things, especially follow-up compliance. For example, if you're going to give a PI patient a back brace for $1,000, which most PI pays for back braces, TENS machines, laser, decompression, even shockwave, all these technologies, PI, will still pay. So you just want to make sure that you can prove the clinical necessity if you're going to do it. For example, for a back brace, my recommendation is like the purpose of a back brace is to provide stability.
Mhm.
So it would behoove a doctor to do certain orthopedic neurological tests like the catch sign, the apprehension sign to see, oh, Mrs. Jones, try and bend and try and touch your toes. And the patient goes, oh, I can't even do that. That's a sign of instability. That's a sign leading up to like a little breadcrumb trail leading up to a back brace.
Yeah.
And then compliance. Now the patient needs a back brace. Also, if the patient has underlying spondylolisthesis, spondylosis, again, here I'm combining my a Cairo experience with my coding experience, so
It's helpful.
that's, yeah. So now the follow up. Most insurance companies say if you're going to prescribe a back brace, a TENS machine, some of these TENS units are being reimbursed for $800-900, home traction $1,000. So insurance companies they want to see if like if I get paid as a doctor $1,000 for a back brace and I give it to a patient, they take it home and they put it on the shelf and they never wear it. That's not good. That's called abuse. That's a waste, So insurance companies want to see in the notes about 2 weeks after, Mrs. Jones, how's it going with the back brace? Mr. Thompson, I prescribed that TENS unit or those exercises. How is it going? Document that.
I was going
That'll
to
prevent.
make sure you document the follow up because it's showing that you're
Yes.
actually following through and they're complying.
Yes. Now, you mentioned credentialing before. Medicare allows chiropractors to become credentialed to get paid for DME.
Yep.
In the DME credentialing process, it states that you have to show the medical necessity and you have to do a follow-up visit to make sure that whatever you prescribe, the patient is actually using. There were times like I had one client. He's like, Marty, I sold this patient. I got paid like $1,200 for a back brace. The patient comes in a couple of days later and said someone stole the back brace out of her car.
Mm.
So what happens? No problem. Insurance allows those situations. Yes, you'll get paid again.
Oh, that's
You'll remeasure the patient. And yes, the doctor will get paid for another back brace, so those
great.
little things come up.
Yeah.
One more thing with PI,
Yeah.
and that is avoiding dual fee schedules. It's very tempting if I tell a client, Doc, in your state for PI automobile accidents, the fee schedule is 370 a visit. You can get paid $370 a visit. So most doctors will bill 370. They'll maximize reimbursement, which I don't see anything wrong with that. If you
Right.
can get paid $1,000 for an adjustment, go for it. I wouldn't, And now if you're charging $10 for an adjustment, I would say, why so little? But if you want to get paid more, so a lot of doctors that dabble in PI, they'll bill 2, 3, 400 a visit. And now here comes a cash patient, and they'll do the same exact services and charge $50. That's known as a violation of the dual fee schedule.
Yeah.
So there's ways around it. If people want to, contact me, it could take a while to explain that. But, one thing is don't do the same thing. If you want to if you want to be able to charge $50 and you want to charge PI $350, then don't do the same thing on the cash patients
that you're doing on. Yeah.
Yeah. If you do something different, if you're doing 4 things on PI, then you can't do the same 4. Maybe you'll only do 2 of those so you can get the fee lower, or join a discount medical plan organization like Chiro Health USA. But
I mean, the point is there are workarounds that are compliant and legal with all of this.
Yes.
Awesome.
Yes.
Good to know.
And that's something I do on a regular basis. We get calls all the time. Doc, this is what I want to do. I bought this shockwave device. I want to charge $49 and include a free exam, free x-rays, and an adjustment. How do I do that? Oh, wow. Well, that's a lot to unpack. But let's see, I grew up in Brooklyn, so, I got it, let's try and figure it out.
You gotta duck and jive here a little bit. Yeah, I get that. All right, so now we've got PI, we got major med, and how about top 3 mistakes or things to look out for with cash?
Okay, so with cash, free exams, free x-rays, these advertisements, be careful. This is where insurance companies, if they, like State Farm, Geico, they'll look at ads. They'll say like, oh, this doctor is advertising a free exam. So let's be a secret shopper and see, oh, it's free, but for State Farm and Geico, there's a fee. So careful with the cash advertisements and treating patients the same if they have insurance, like with these special $47 specials. They're okay, they're good, but certain things, it might not be okay. So the advertising, I see a lot, like you said, I'm a cash practice. I don't have to abide by, the rules.
Not true.
Yeah. Well, for certain rules, like you don't have to prove medical necessity to an insurance company. So certain rules are lifted if you're a cash practice. So yeah, advertising. Careful with the advertising. The next thing with cash practices is many doctors are getting patients to prepay, which is terrific. There's pros and cons to prepay plans. Like when I would do a prepay plan, patient would pay for, let's say, 12 visits in advance. These are the best patients. They are the biggest cheerleaders.
Yep.
They never miss their appointments because they've been prepaid.
Yeah.
So there's a lot of pros to so definitely prepay plans. It's just that there are certain things to be aware of. For example, you may need to put the money in an escrow account. In the state of Florida, there's a cap of $1,500. So if you're a chiropractor in Florida and you want to sell a $5,000, or let's say you want to sell a $6,000 scoliosis correction program, or wellness program, you're not allowed to have a patient write a check for $6,000. $1,500 is the cap.
Wow.
So
that's an important nugget right there.
Yeah. So that's, as soon as I bring on a client that's from Florida, I ask them, do you sell cash packages? Most of them do. How much? Decompression is very popular,
Yeah.
So
Yeah.
So putting the money in an escrow and just being careful, because now some of the clients go, well, why do I have to put the money in escrow? Well, here's the issue. If you have 50, 100, 200 or 300 patients that have prepaid you for all this money. So let's say you have, $100,000 of money that has been prepaid. And let's say this would be virtually impossible. All these patients want their money back, and you've spent the money already. So now how are you going to pay all these patients back?
Yeah.
So by putting the money in a separate account that you're not allowed to touch, that ensures that just in case the patients want the money back, you have it. So, because some people, they're not sure why, why do I have to put that money in a separate account? It's just in case.
And that's different state to state.
Yes.
Okay.
Yes.
Good
Some
to-
states you're not allowed to do prepays at all.
Yeah.
So that's a very state specific discounts. Another question, Dr. Collar, I'm in Maine. How much could I discount a cash patient? If my normal fee is $100, here comes a cash patient. Could I go from 100 to 50? Every state is different. Like in Colorado, you can discount as much as you want as long as you do certain things. Like my normal fee is $100. If I'm in Colorado, I could say, Mr. Thompson, my normal fee is $100. How for you? It's $5. Is that okay? All right, just sign this form that, now in other states, no way
Yeah.
can
That's
you
great.
discount, so discounting, escrows for cash. And one more thing about cash is knowing the difference between what's considered medically necessary and maintenance wellness.
Mm,
Many doctors, when a cash patient comes in, I don't want to say many, some doctors, when a cash patient arrives at the office, they automatically enter the code of S8990. That's the wellness code. And I would say to the doctor, wait, why would you use a wellness code? This patient has screaming sciatica. Well, it's a cash patient. Wait, don't confuse a cash patient with wellness. So that's why I like to put patients into two categories. Now, I know a lot of chiropractors, they use phases of care. They
yeah.
place patients in,
Maintenance.
this patient is in the acute phase, subacute, relief, active, medically necessary, therapeutic, wellness, maintenance, corrective, restorative, perform. There's all these different phases. I've narrowed it down to two. So when it comes to cash practices, when you're in the room or once you leave that room, you have to make a decision. Was this active medically necessary care, or was this wellness maintenance care? Now you're
Mm,
saying, wait a second, Marty, I'm a cash practice. Well, what code are you putting into the computer? Like into Genesis, if a patient is coming in for a adjustment and they have pain, they have discomfort, they have difficulty bending and lifting, this could be a cash patient. What CPT code are you going to put into Genesis? You're going to put in 98940, 41, or 42. That's the code for a spinal adjustment for active medically necessary care.
yeah.
Now here comes Mrs. Wilson. You walk into the room. Hi, Mrs. Wilson, how you doing? And she says, I feel great. I don't have pain. I don't have any restricted motion. So now this is a cash patient. What are we going to enter into Genesis? We're going to put S8990. This patient has no pain, is in the wellness phase of care. So now the patient says 2 weeks later, 3 weeks later, can you give me a statement, an invoice? You already have the right codes.
Yeah.
It's in the system.
It
So
just
knowing the
it feels so
difference.
good to be able to give someone something when it's right. An accurate statement and accurate codes. And so I really appreciate how in depth and how methodical and how organized you are with all of your coding and the laws and the legality behind this. It's such a powerful tool that we all need to put in place.
Yeah, we work hard to,
Yeah.
keep doctors in, like you said, keep them out of trouble. That's
Out
our
of,
goal. 80% of doctors
out
we
of orange
work.
jumpsuits. Sorry, I always thought
Yes,
of myself in an orange jumpsuit, and I don't want
yeah,
to be in one. Not at all.
no pinstripes, no orange jumpsuits. And just to share with everyone, 90% of the doctors we work with are not in a crisis. They're not being audited. They're not going to jail. They hire us to prevent and avoid problems. 10% are in a crisis. They've been asked for money back. They're in trouble. They're being audited. Those are, it's like in practice, if I had a patient come in that has throbbing severe pain in their neck down the arm, I have to think more. I got to pay attention more. It's more,
Very different.
decision making versus here comes Mrs. Jones. She's here for a wellness adjustment. I don't have to think as much. So for 80 to 90% of the clients, it's prevention, it's avoiding, it's the treat, the trainings are enjoyable versus that I have a doctor right now. He's being audited. Cigna wants $636,000 back.
Ah,
That's one of my biggest cases.
yeah.
$636,000. That's what they're requesting that he, pay back. So you want to avoid those things.
Yeah, yeah. 636K. That's a big number. So,
Yeah.
well, Dr. Kotlar, thank you so much for the tips on PI, tips on cash, tips on major Medicare, and just all the pearls of wisdom you provided. For those of you who haven't enlisted Target Coding and Dr. Kotlar's team, I really suggest get out there, give them a call, work proactively so you don't become one of those, 10 to 20% who's in the acute crisis. Because you obviously can provide a good platform of integrity to practice well and smart and intelligently. So thank you very much for joining us here on Genesis Nation. We look forward to our continued strategic and success partnership. Thank you.
Thanks for having me.